Good afternoon, ladies and gentlemen, dear colleagues from Italy and from Romania and from other member states of the European Union. My name is Luigi Bertinato. I'm the head of office for the Scientific Secretariat of the Italian National Institute of Health, while I'm representing the President, Professor Brusaferro. I have the great honor and pleasure to present his best greetings to all of you. The President is following the important work that the rare disease community is doing in facing the pandemic of COVID-19. And it is on behalf of the President, Professor Brusaferro, that I'm officially opening this first international meeting, which is part of a series of workshops that together, jointly with the Italian National Center for Rare Disease, led by Professor Dominica Taruscio, the Institute is offering to the important community of rare disease in Italy since the first wave of the pandemic. I have to say that it is relevant for an institute of such size to deal with the community of rare disease, both for the scientists and both for the patients and the families that they are taking care of the patients. We think that the fragile communities are those who are at risk of suffering of the most for this pandemic. And definitely we are taking care, we are paying great attention to the community of rare disease. So it is really a great pleasure for today's meeting to welcome officially the colleagues from Romania, in particular Dr. Emilia Severin and Dr. Dorica Dan. And I have to thank them officially for sharing with us the experience of Romania. I have also the responsibility to thank Professor Turchetti from the Scuola Superiore Sant'Anna in the Italian city of Pisa for having accepted to participate and attend this scientific meeting. Having said so, and having officially opened the meeting, I think it will be the first of a series of international events because we are very pleased to share the experience in Italy with the colleagues from all over Europe and outside Europe. We strongly believe that it's the best opportunity, in particular for those who are called non-pharmaceutical interventions, to try to solve the problem and to reach really together with the fact that finally we got the vaccines, the first and the second type of vaccine accepted and approved here in Italy. I think the non-pharmaceutical interventions are those who were effective since the beginning of this pandemic. It's my pleasure now to officially give the floor to Dr. Annalisa Scopinaro, which is the President of the Italian Federation of Rare Disease, for some addressing words to all of you. Annalisa,
Thank you, Dr. Bertinato. Thank you for this presentation. It is really a great pleasure to be today with Dorica and with Professor Severin, because we have had some, meetings with them during our meetings in Europe. Dorica is a member of the board of Eurordis, so she is a friend most of all, and she is also my friend and colleague in Ithaca, in the ERN Ithaca. We are both IPAC representatives. And it is really a great pleasure to welcome them, because this is the first webinar in 2021. And to start with an international breath is a great pleasure, because our webinars are not only owns, but of the community of people with a rare disease. And I know that other people are following us, even if we are taking them in Italian. And we are trying to translate our webinars. And I think in the next one, we will do that also in English, from Italian to English and from English to Italian. So stop with my terrible English. And thank you again. And thank you, Dorica, to be here today with us. And thank you also to the other colleagues, and to Dominica, that is the real one that it is, how can I say, l'anima in Italian, that is the person we do all these webinars, even if they are in the Superior Institute of Health in Italy. Thank you a lot.
Thank you, Dr. Scopinaro. I fully agree with you. So it's my great pleasure to pass over to the chair of this session, the director of the National Center for Rare Disease in Italy, Dr. Dominica Taruscio. Dominica, the floor is yours.
Thank you very much. Thank you. So thank you very much, friends, colleagues, and everyone. First of all, Happy New Year, because this is our first webinar in 2021. So we really hope that this year will be better, of course, of the past one. And it's a pleasure, because we started this new edition, international webinars, which give us more possibilities to share our experience, our knowledge, our science, our best practice with other countries. And other countries can, of course, share with us. So it's a double level of exchange. I would like also to say to our Italian patients group that may have some problems with the language. The webinar is translated in Italian on the Facebook that Uniamo is providing. So please, if you cannot follow easily English, go to the Facebook, direct Facebook, and there is direct of Uniamo, and there is the translation. So next webinar will be even better. But for sure, we will continue this international initiative, because I think we need really to open the horizon. So now, it's really my pleasure to introduce, first of all, Professor Emilia Severin. Professor Emilia Severin is, first of all, my friend, so I would like really to give her a big hug. She's professor at the University of Medicine and Pharmacy in Bucharest, in Romania, and we shared so many projects, European projects, so many experiences in the field of rare diseases. And now it's a pleasure that she will also share the topic of rare diseases and COVID in Romania. So, Emilia, the floor is yours. Please, you have 20 minutes. So we planned also to have a discussion, but so you can present what you prepared very nicely. Thank you.
Ok. Ci sentiamo? Sì. Buon pomeriggio a tutti, sono Emilia Severin, professoressa di genetica all'Università di Medicina e Farmacia Carol Davila a Bucarest. Mi rallegro di essere insieme a loro di nuovo alle interessanti e utili webinari che l'Istituto Superiore di Sanità organizza per la comunità delle persone con malattie rare dappertutto. Ringrazio per l'invito, non anche per l'opportunità di condividere la nostra esperienza della comunità romena delle persone con malattie rare acquisita durante la pandemia Covid-19. Inizierò la mia presentazione con la caratterizzazione generale del profilo paese per le malattie rare. Avanti, prego. Vorrei far sapere chi siamo e cosa facciamo. Romania ha una popolazione di circa 19 milioni di abitanti, di cui si stima che 1 milione sono persone affette da una malattia rara, il che significa praticamente una persona ogni 19 abitanti dal paese. Purtroppo, secondo le nostre stime, 25 dei malati rari a meno di 18 anni. Si sente? Non vedo. Posso dire? Sì. Il 25% rappresenta una grande popolazione pediatrica. Si può dire che sono rari, ma non significa che sono pochi. Nel 2016, su decreto del Ministero della Salute, sono stati organizzati centri di expertise in Romania. Attualmente ci sono 27 fornitori di servizi sanitari specializzati. La Romania partecipa a 7 delle 24 reti europee di riferimento per le malattie rare e tumori rari. Nel 2007 è stato un momento molto importante per la comunità di malati rari in Romania. È stata fondata l'Alleanza Nazionale per le malattie rare di Romania.
Emilia, sorry, can you understand? Can you hear me? So,
yes,
sorry.
I hear you.
Yeah, thank you. So, we disseminated the information that the webinar will be in English. So many other countries will we are listening to us in English. Could you please speak in English? I thank you very much that you really made the best to speak in Italian, but I think it's better for the community, international community, to speak in English. Yeah, thank you.
Va bene, grazie. In Romania, there is a Romanian National Alliance for Rare Diseases. It is 84 patient associations are included in National Alliance for Rare Diseases. Speaking about legal framework in 2014, il Ministero, Health Ministry adopted National Plan for Rare Diseases as part of national strategy for public health. I have to say that it was a hard work to establish a national plan for rare diseases, but it was hard work in some together with Dominica. I want to thanks again for her efforts and for help to get a national plan for rare diseases. In Romania, there are also national programs for rare diseases. Ministry of Health are established few dietary program, dietary treatment for few rare diseases, and National Health Insurance established some curative treatment. In Romania, since 2013, there is a National Advisory Council for Rare Diseases, is a committee which help is as the name says is an advisory council for Ministry of Health. Next slide, please. Sorry, I have to say that in Romania there is not a national rare disease registry, and this is still a challenge for our community and for our Alliance for Rare Diseases. Next slide, please. Avanti. Speaking about timeline of COVID pandemic in Romania, at March 16, 22, President of Romania established state of emergency, meaning that it begins national lockdown, and it was a very difficult period for us with severe restriction. This period was 60 days because at May 15, the President of Romania stated state of alert, meaning relaxation measures. Unfortunately, the number of cases with COVID-19 erano grandi, erano very sorry, penso in italiano, erano very high, and at November 6 il Presidente and Ministero della Salute, Ministry of Health, has decided to establish partial lockdown. Next slide, please. Avanti. Number of coronavirus in Romania as of January 12 this year, 2021. Total number of cases are 6,000 of patient with coronavirus. Total recovered are 6,005. Total deaths, unfortunately, 1682. 81 deaths. Il governo, the Ministry of Health decided to adopt vaccination for people, and since today, a number since 27th of December was initiated the process of vaccination of people in Romania. Next, please. Avanti. The impact of COVID 18 pandemic on the Romanian rare disease community was very difficult because the global pandemic has negatively affected people with rare diseases and their quality of life, causing disruption in all aspects of daily life, disruption of care continuity, appointments, medical treatments, rehabilitation care, canceled, reduced or postponed, treatment changes, switch from hospital to home therapy, difficulties in getting their medicine, patients and families lacked relevant information on how COVID-19 will affect them individually. COVID risk kept them away from seeking treatment in hospital or ambulatories. And positive part was that coronavirus lockdown was an opportunity to strengthen family ties. Next, please. Avanti. The results of a survey conducted by Romanian National Alliance for Rare Diseases from April 28 to May 9, 2020, revealed that 42% of patients completely 22% or partially 20% discontinued hospital treatment, and 2% received treatment in a different hospital, COVID-free, than usual. In Romania, hospitals were transformed, a part were closed, and a part were transformed in COVID hospitals. Discontinuation of treatment or therapy was a joint patient specialist, unilateral specialist or a patient decision, a decision of the authorities or the healthcare providers as a measure to reduce the risk for infection with SARS-CoV-2 infection. These decisions were mainly based on the risk-benefits balance associated with curative therapy, difficult access to healthcare, or the concern of patient and their families caused by the lack of personal protective equipment and the risk associated with exposure to SARS-CoV-2. The survey also highlights the difficulties of access to the prescribed medicine due to the impossibility of its delivery of administration at home, the collection of biological tests at home, as well as the lack of safe transport to a health facility. Avanti, prego. The impact on COVID-19 pandemic on the Romanian healthcare system I have to say that in Romania, the majority of medical services are provided through the public health care system. This is a problem, I think, because it's a centralized system. Hospitals were required to suspend all non-essential visits, reduce non-emergency services, and postpone elective surgeries to focus manpower and resources on combating COVID-19. Healthcare provider and doctors substituted face-to-face medical visits with teleconsultation, and prescription were sent by email. As a response of the healthcare authorities to COVID-19 crisis was regulation of the legislative framework for the implementation of telemedicine solutions. Thus, decree of government changed the law on healthcare reform. Next, please. Avanti. In Romania, this document established by Ministry of Health and Romanian government define the telemedicine and telemedicine services. Telemedicine is include all medical services provided remotely without the simultaneous physical presence of medical staff and the patient to establish diagnosis, indication for treatment, monitoring of diseases or methods or disease prevention securely using information technology and electronic means of communication. Telemedicine services include teleconsultation, telemonitoring, tele-expertise, tele-assistance, teleradiology, and telepathology. In Romania, teleconsultation and teleradiology were used for a short time, but the other, tele-expertise, tele-assistance, and telepathology and telemonitoring are new. This decree is both for public and private sanitary units. Next, please. Avanti. The government decision also regulate medical specialties and the list of services subject to telemedicine services, the condition for the organization and operation of telemedicine, the responsibility of establishing the quality of the telemedicine services, of verifying its observance under the condition of law on quality assurance in the health system with amendments and completion, the manner of providing telemedicine services. Next, please, Avanti. Conclusions. I think the problems, all our problems are similar to the other country. The difference is that solutions and authorities find other solutions, and the experience gained in this period, both by patients and by the centers of expertise for rare diseases, draws attention to the need to update and complete the legal framework in the field of health, social and education. In Romania, there is a problem, let's say a challenge, because the quality of life of the patient with rare diseases are under control of three different ministers of health, ministers of labor, and Ministry of Education. This is a problem because the government has the task of planning at the national level and dedicating an adequate budget to complex needs of patients with rare diseases. Separate administration, but by separate ministries, the Ministry of Health, Ministry of Labor, and Ministry of Education, requires the coordination of their action to ensure social security and integrated care. Next, please, Avanti. At the end, I wish you stay safe and healthy, and thank you.
For the double effort, because you speak an excellent Italian and an excellent English.
No, thank you. Thank you.
Thank you to you, because it's a pity. I know that you speak very well in Italian, but nevertheless, we invited to speak in English because many countries are following today this meeting, and I think we can really share in a common language, which is English, of course. So you spoke about e-health. This is interesting, and telemedicine. And I can tell you, I can anticipate that the same happened to Italy. And in fact, one of the benefits, let's say, if you can say so, of the pandemic is that accelerated a lot in many countries the use of telemedicine. And in addition, also, now, for example, in Italy, as well as in Romania, we have a framework, a legislative framework. You also spoke about the Center of Expertise of European Reference Networks. I think that the last presentation will tackle this issue, so we can have really the possibility to share information, experience, and models. Now, it's my pleasure to invite Dorica Dan. Dorica is, of course, one of my best friends in Romania. We know each other since many years. And yes, she's the president of the Romanian Alliance for Rare Diseases, National Alliance for Rare Diseases, RONAT. But she's also a member of the EURORDIS board of directors. And she's very, very active. So she will speak about rare diseases and COVID in Romania, but from the point of view of families and patients. Please, Dorica, the floor is yours.
Thank you very much, Dominica. Thank you, Annalisa, for the introduction. And I'm very happy to be today with you. And thank you also for all the webinars that you organized last year, because we could follow your webinars, and it was very interesting to see how you approach this difficult period. And I'm honored to be here today with you. So my name is Dorica Dan, and I'm representing patients with rare disease and rare cancer in Romania, because my daughter Oana, which is 35 now, had Prader-Willi syndrome, and she was very late.
La regia non si sente più.
Can you hear me?
Yes, now yes.
Okay, I don't know what.
Go on.
Okay. Sorry. So I'm representing patients with rare disease and rare cancer in Romania. Next, please. Of course, as many other organizations for patients, everything started because our daughter Juana have a rare disease, Prader-Willi syndrome, and she was very late diagnosed when she was 18. In fact, she was diagnosed in Italy, and it was the time when I met for the first time Dominica in Pesaro, and it was very important for us to see that there are other patients with the same rare disease as our daughter, and to start to look for the patients with the same disease. But because we were scared that we will not find other patients with Prader-Willi, we dedicated our association to Prader-Willi and other rare genetic diseases, without knowing what means really a rare disease at that time. Then we realized that having an association for individuals with rare disease is not enough for Romania. And in 2007, we decided to bring together other patient organizations with rare diseases, and to organize the Romanian National Alliance for Rare Diseases. Now our alliance have 48 members, and we are part of Eurordis, as you mentioned, and also members of the Rare Disease International. Next, please. Of course, we had the same problems with our daughter as any other patient with rare disease, or now the world have encountered the same problem, not knowing which is the enemy and how to face a disease. So during pandemic, many people understood what means to look for a diagnosis and what means not to have a treatment. And we hope that the humanity and the global the entire world will understand better the needs of patients with rare disease, to raise the awareness and to find a solution, because most of the patients have still no treatment. More than 90% of the patients with rare disease have no treatment. In Romania live 1 million patients with rare diseases. Most of them are still undiagnosed. And because 50% of our population in Romania live in villages, sometimes they don't know where to go and where to address for support and for the services that they need. And if we have 1 million patients, it means that at least 4 million of our population is affected. 20% of the Romanian population, because the entire family is affected when you have a child with a rare disease. Next slide, please. The biggest project and the most important project, and during this pandemic, we realized how important it is to be close to the patient and to answer to the needs of patients in our activities. So the most important project is Neuro Center that we opened in 2011. And our center is one-stop shop service, because it is combining therapies, therapeutic education, training for patients, rehabilitation, medical and social services. It is accredited, and it is also accredited as a center of expertise, and it is part of ERN Itaca. Next slide, please. As Emilia already mentioned, in Romania, most of the time, our national authority are declaring that rare diseases are a priority for Romania, but they are tempted to forget sometime about this. We all know that there is no integrated services, also because, as Emilia mentioned, we have different ministries approaching different problems of the patient. And it is very, very difficult to bring together and to bridge the gaps between all the services for our patients. Next slide, please. I tried to just to introduce the Neurocenter to those who probably didn't see it, because a part of our problem during pandemic was how to sustain our activities at Neurocenter. So when we established the center, we had some challenges, but also opportunities. But as you can see, we started with some buildings that we received from the local authorities, very old, and we have, in fact, to rebuild everything. The challenges were, as you know, low numbers of patients, low interest from the authorities, no other services like this. So we had to look for what kind of services would be better for our patients in Romania, both at level, but also to approach the community of rare disease at national level. It was no collaboration between social and medical services or between national and local services, no information accessible, and no cooperation between professionals and patients, and not even between patient organizations sometimes, I would say. But also at that time, there were some opportunities that supported us. It was the international collaboration that we established as a patient organization, both with EuroRDIS, Rare Disease International Prader-Willi organization, but also, like I mentioned before, with Italian organizations for rare disease, Prader-Willi organization, or National Istituto Superiore di Sanità with Dominica, and other Orphanet Europe and other stakeholders involved in rare disease. We started to collaborate with professionals and bring together with the patient organizations in the National Alliance for Rare Disease, the Romanian Society for Human Genetics, which is very supportive and a great partner for us. Then there were some funding opportunities and at European level, but also at national level. It was EEA grants that we could apply for, and we found the Center Frambu from Norway that is a great model for our services, and we could replicate some of their services in our national context, but also we had to adapt these services to the needs of our patients and to our realities. We fight it together for a local strategy to include our services in the local strategy, in the regional strategy, but also in the national plan for rare disease. And because otherwise we had no chances to sustain our services. We started to organize Rare Disease Day campaigns, and all these services or all these actions could be found in the European Commission communication and recommendation for rare disease at European level. We participated in Europlan project, in European Joint Action for Rare Disease, in Healthcare, and RD Action. Next slide, please. All this experience have helped us to transform Neurocenter from a project to a healthcare providers to improve the quality of life for patients affected by rare disease. Next. So if in the project we had an objective that to create a rare disease task force, a platform to debate and to establish a national plan for rare disease, that became in time, and it is still in place since 2008. It is a team of patients and professionals, which now is National Council for Rare Disease, a commission of the Ministry of Health that is following the implementation of National Plan for Rare Disease in Romania. Next. Next. The center, which was in the project Pilot Reference Center for Rare Disease, became a center of expertise. Next, please. In the meantime, of course, it's not about a building, it's about service accreditation and all the expertise that we bring together in our center in order to answer to the needs of patients with rare diseases. Next, please. The best practice exchange with Frambu at that time became a permanent exchange. And next, please. And we created in InnovCare project, because we are still partners. We never split after a project. We continue to work together with our partners. So we became Rare Resource Net, which is a European resource center, a European network for resource centers like Noro or Frambu in Europe. Next, please. And if in the project we developed an e-university, which is a website, an online tool for different professionals, now it became, next please. It is accredited and authorized, and we created an online platform for NeuroCenter to extend our services in online. Next, please. So these are some of the results over the year for our center, and I will say just a few of them. So we had 1,722 patients in our services and therapies at Noro. More than 900 patients are in our patient registry at the center since 2015, when we established our own registry. Through case management, we connected to care services 2,226 patients. And we had in our ambulatory, because we have medical and social services, as I said, we have genetic department and also psychiatric department in our center. And we had 3,400 consultations in our department, medical department. We have included in our services, in our trainings, for instance, 120 community nurses. We have 2 national plans for rare disease integrated into the National Strategy for Health. And during 2020, we worked to update the national plan, and we hope that it will be included in the next strategy for health. And we had in our rare disease school for journalists in the last 9 edition more than 250 journalists, because in the meantime, since we created this information, we had another edition. So we have more journalists that we train. Next slide, please. When pandemic came in March, at the beginning of March, we were thinking, what can we do for our patients, but also what can we do for our community? Because we are living in a small town near the border with Hungary. We are far from the capital, so we were thinking how to support our community as a patient organization to face to this pandemic. So we were involved and to support the local community by improving the genetic testing. We borrowed our DNA extractor, and our geneticists were training those who in charge for performing the testing for COVID-19. We provided protective equipment both for our beneficiaries, but also for other healthcare providers in our county. And we provided them with some respiratory equipment for patients. And also we worked with our experts to provide patients with guidelines for different rare disease groups. That was the first actions that we did when we closed the center on 12th of March. And we try to keep us ongoing and to be in touch with our patients and with all the families to continue to support them and help them to face to the crisis. So we created this project that is called Active Rare Networks, and we try to participate in different networks, even networks that we didn't think before, in order to create new projects for our patients and support the community. Next slide, please. We have participated in Eurordis questionnaire to see how pandemic affected patients with rare diseases, but also we established our own questionnaire to see what impact had COVID-19 pandemic on Romanian patients. So we realized the first questionnaire was applied at the end of April and beginning of May. And we had 353 questionnaires filled by the patients. And at the end of 2020, we renewed the questionnaire, and we had, until now, we have 450 answers. So the results that I'm presenting now are the results for the first questionnaire. And at that time, we realized that 42% of our patients, of hospitalized patients, completely or partially discontinued their treatment. And 2% of them have received treatment in other hospitals than usual. Comparing with Eurordis, as Emilia already mentioned, the situation in Romania was not very different from other countries, because we can see that the results at European level say that 3 out of 10 patients reported that the hospital they would usually get treatment was closed. Next slide, please. Also, 72% said that there is a possibility to take medication at home, and 20% said that there is no such a possibility. And we had no legislative framework for home care for those who had infusions in hospital usually. So we had to advocate together with professionals, but also with the members of the National Alliance to advocate for home care for patients with rare diseases. And it was created a legal framework that the patients with rare disease can have with the
problem with
their experts, the treatment.
Dominica.
Sorry?
We cannot hear you. Okay, now it's back. It's go on.
Yeah, sorry. So 72%, did you hear this slide or not?
Half of it.
Okay. Next slide, please. So one of the major concern was that patients that had treatment in hospital had to quit the treatment and to stop the treatment because the hospitals were transformed in COVID support hospitals, and they were also scared to do their treatment in hospital. They were scared so not to be infected. Also, patients, 38% of the patients said that they couldn't continue their therapies, or they couldn't continue their rehabilitation programs in different services or hospitals. It was almost the same in Europe. Next slide, please. Also, 58% of the patients said that they had to give up physical therapies and psychological support. And Eurordis mentioned that 8 out of 10 patients experienced cancellation of recovery treatments and therapies in Europe. Next slide, please. Also, 46% said they had problems with ensuring continuity of care, and 40% of these patients mentioned that they couldn't find their treatment on the market. Next slide, please. Regarding access to online services, 88% said they were happy to use online services during this month, and 76.29% mentioned that they use this for online consultation. And since June 2020, online consultations were approved by Ministry of Health and National Health Insurance to be reimbursed. at the same level as the face-to-face consultations. Next slide, please. So from the very beginning, I realized that I'm responsible at least for 100 people at Neuro Center, and they were isolated in house in March, April until mid of May. And we had to support these families because it was an impact on them. They had a psychological, social lack of access to therapies or other support. And we had to continue to call them. We tried to do therapies on WhatsApp and on phone to support families to have different strategies to support their children and continue intervention. Since 18th of May, we started again face-to-face therapies at Neuro Center, and luckily until today, we had no infection at our center among the beneficiaries. Of course, their family members and also among our team, we had people that had COVID-19, but none of our beneficiaries was infected, and this is very positive because we took a lot of measures to protect them, and we reduced the number of therapies. We increased the number of rooms used at Neuro Center to provide therapies in order not to meet each other and to have mainly individual approach. Then a huge impact, it was on Neuro Center team. And 50% of our team was unemployed for 2 months, and that was very scary for our team. And it was unpredictable future for them. We tried to sustain our services and keep them motivated. We met every day online on Zoom to make plans for future, to write projects, and to continue to keep them busy and to increase their faith and hope. At the National Alliance for Rare Disease, where we realized that patients are afraid of isolation, and they are afraid to be infected. They had to interrupt their treatment, as we have seen in the survey. They had home care challenges, limited access to hospital or no access to hospitals, limited access to expertise, and no access to rehabilitation. And for majority of them, where there is no treatment, only rehabilitation is a solution for them, that is support. So we try to continue to support them and to organize meetings in order to keep their hope. Next slide, please. So we provided patients with equipment, we write projects to support them for home care and to deliver them with infusions and protective equipment. And we trained nurses that have to provide their infusions. Of course, we started new collaborations, networks, and a totally new approach at Neuro and at the National Alliance. We supported families with psychological consultation therapies and support materials. We have also organized, we tried to move all our services in online, and we started since June to test our online platform for therapies, and we are organizing, we can provide therapies online, we can provide consultations, and we are organizing groups for patients with rare disease online. So until now, we had 214 patients that benefited from our online platforms, Neuro Online, for therapies, and we had 6 groups of patients, 5 days for each group. And we have trained during this time 850 community nurses on case management for rare disease, using ECHO method, which is extension of community health outcomes online. And we organize regular meetings with National Alliance members and with the Centers of Expertise and National Council for Rare Disease to update National Plan for Rare Disease. We organized advocacy meetings to solve the problems with hospital admissions, with home care, telemedicine framework. And we try to involve all the stakeholders. And we organize Europlan conference online and Rare Disease School for Journalists in online for 3 days. And it was quite interesting, and people were participating very enthusiastic. Next slide, please. Of course, we had a challenge in order to implement projects online, to create digital solutions. We needed new skills, so we tried to understand what is the donor motivation, how to do campaigns online, how to fundraise online, and how to do digital marketing, or how to be GDPR compliant. And in order to do this, we applied with our projects to Ashoka Changemakers United Europe, and to Accelerating Health Access at Philips. And we were 8 months in a project for globalizing our solution. Next slide, please. We had a lot of support. We experienced during this period volunteers, experts from different enterprises at international level, like Utopic Brain or Denton, Steelcase, Philips, Accenture, Global Giving, and Zalando. And we worked, as I said, in projects with Philips in accelerating health access for virtual case management for patients with rare diseases for this project, with Human Collective to create prototype and user testing questionnaires, and with Informal School for IT from Cluj, we work on an app for risk alert in rare diseases. Next slide, please. So we also created, as I said, Neuro platform online for online consultations, therapies, psychological and social counseling, organized thematic support groups, accredited training for community nurses from ECHO, New Mexico. And we are working currently to finalize our application on virtual case management. And I have to say that for the first time, I realized that online we can support in our support groups online patients, Romanian patients which are living abroad. So in our groups, we had patients even from Canada, and also that we can have expertise from all over the world, including Romanian doctors living abroad, but also Romanian from different regions of the country, because online there is no barrier. And they were happy to be supportive on this platform and meet with the patients. Next slide, please. So which are the next steps? It is interesting to think, but because of vaccine, we think that better things are coming, and we need to keep our teams motivated and fight for our vision, because vision without action is dreamland. Action without vision is a nightmare. Thank you. If you have questions, I'm happy to answer. Thank you.
Thank you very much, Dorica. Thank you very much. We will have some space at the end of the webinar. And what can I say? Congratulations. Congratulations, because really I mean, I don't have words to thank you. And I knew that you are very, very active with your center. In fact, I would like to remember to our colleagues that Noro is the only healthcare provider in Ithaca, in all European reference networks, which is coordinated by Dr. Dominica, which is, as she said, mother of a person with brother Willie. So I would like really congratulate, and we will exchange a lot between the two countries, because you did many activities that we can really, improve our system and exchange with you other activities. Now I would like to invite Professor Turchetti, and he is from La Scuola Superiore Sant'Anna in Pisa, and he will present us the organization points to consider to protect rare disease patients in the COVID era. We touched several points, but I think that now we can really go further and see how we can tackle these aspects. Please, Professor Turchetti, the floor is yours. Thank you
very much, Domenica, first of all, for inviting me today, but in particular for having organized this meeting that is really very interesting and important, because only from the sharing of different experiences we may really improve our systems. As Domenica was saying, I'm an economist. I'm involved in health economics, in healthcare management, and since I would say several years now, I'm also involved in the area of rare diseases. So I would like to highlight some of the key points that we could consider when we address the management of rare disease patients during emergencies like the one that we have experienced or we are still experiencing related to COVID-19 from the organizational point of view. So avanti. We are living very difficult times, and also health policy regulators, health policy makers have difficult issues to address and difficult questions to answer to. How to manage the uncertainty, as we have experienced in the last month, but also today, we do not know what will happen in the next weeks. So the uncertainty is very high. How to manage the trade-offs, how to cope with the emergence of new priorities with respect to the normal life, how to redefine the resource allocation strategies. These are key issues that health policy regulators, health policy makers have to face in order to manage the current scenario. Avanti. So the issue here is how to make health policy makers, health policy regulators in these very difficult times where the priorities are different from the standard one, from the normal life ones, how to make them aware of the relevance of rare diseases from a health, economic, organizational point of view, how to make them available to invest, continue to invest in the area of rare diseases, how to make them committed in addressing rare diseases issues also during these difficult times. Because the risk for many chronic diseases, but in particular for rare diseases, is to neglect these diseases as we have to address criticalities related to the pandemic. The next, please, Avanti. So one strategy might be to work to focus on the concept of opportunity cost for the national healthcare system, for our national healthcare systems, and for the society overall in the short, medium, and long term. In other words, we should be able to highlight to the policymakers what might happen if we do not invest, if we do not focus, if we do not treat in the proper way rare disease patients. So the idea is to help policy makers in considering and properly addressing the health economic dimension, the health outcome dimension that we may face if we do not treat properly rare disease patients, in considering and properly addressing the economic dimensions, the economic implications, and in having them very well aware of the organizational dimension that is behind the management of rare disease patients, highlighting the concept that the organizational dimension is not neutral. It really matters in providing an efficient and an effective healthcare service to rare disease patients. And I would like in this presentation to focus exactly on this dimension, the organizational dimension, showing that it really matters. Avanti, per favore. We already had in the previous two presentations the most important highlighted the most important implications of COVID-19 pandemic. This pandemic had a substantial effect on numerous dimensions of healthcare, especially in the countries like our country, where the outbreak first emerged. Avanti. And because of the pandemic, our national or regional healthcare systems had to reorganize their activity, facing this unprecedented challenge and having to deal with and to take care of a tremendous number of patients with COVID-19 in need of high-level care. So they, the healthcare managers, the healthcare policymakers, had to concentrate resources for dealing with the pandemic, for dealing with this new priority. And this inevitably has affected the resources dedicated to the management of all the other conditions and limiting the performance of routine care, as also Emilia and Darika have highlighted. Avanti. Over. And this reorganization, of course, has affected all the different diseases, in particular chronic diseases. But in the case of rare diseases, this limitation played an even more important role and had an even more important impact because of the unique characteristics of rare diseases. They are complex because of their complexity, the risk of complications. They require a complex multidisciplinary approach and a strict monitoring of the evolution of the disease. So the necessity to keep the patient safe and to keep them very often away from the hospitals for two reasons. The first, to protect the patients because in the hospitals the risk of infection was higher, and on the other side because the hospitals had to focus on the new priority, on the management of the pandemic. So in the case of rare diseases, this condition played an even more important role. Avanti. Over. Avanti. So the organization of care had a very important role in this pandemic, and the key issue was with respect to chronic diseases, and in particular in rare diseases, was how to maintain the continuity in the provision of care for rare disease patients. And in fact, as also the surveys that the colleagues highlighted before and showed us before, highlighted the key issue in the last month. That was the interruption of the care provided to patients with rare diseases. That was one of the most important implications. So we should try to learn from the last month in order to be ready for possible potential future emergencies that may impact our healthcare systems and in particular rare disease patients. Avanti, per favore. Here you have a picture showing the clinical challenges faced by patients and healthcare providers during the COVID-19 pandemic, and this is a result from this picture results from a survey that we conducted within one of the 24 ERN funded by European Commission, and in particular Reconnect, that is focused on the connective tissue disease, rare connective tissue diseases. And here you can see the different clinical challenges that the healthcare providers in the different European countries had to face in the last year. So limitations of the diagnostic process and routine monitoring of patients with rare connective tissue diseases, how to manage infection risk in patients already taking immunosuppressive therapies, how to manage infection risk in patients starting new immunosuppressive therapies, the limited access to some drugs for rare connective tissue diseases like hydroxychloroquine that was also used in the treatment of COVID-19 patients, the impossibility of performing face-to-face evaluations, the disease relapse due to patients suspending therapies autonomously, and this also happened and has been highlighted in many surveys in the last month. So these are the most important clinical challenges that have to be that the patients and healthcare providers had to face in the last year. Avanti, per favore. And these clinical challenges also had important organizational implications, because we experienced the interruption of care for patients with rare connective tissue diseases, how to organize a new service, a new monitoring of the patient through telemedicine services instead of face-to-face evaluation, how to manage the uncertainty in the availability of the supply of some drugs, how to prioritize the essential and or emergency health services, how to manage the reassignment of healthcare professionals in the rheumatological units to COVID-19 units, so with a reduction of the supply side of these services. So how to manage with this shortage of clinicians, specialists, how to reorganize the patient flow through clinics to accommodate social distancing requirements. So how to keep safe patients, rare disease patients, visiting the hospitals. Avanti, over. So we came out with in a synthetic way with these questions that are relevant from an organizational and health economic point of view. The questions are: how should care be reorganized to guarantee continuity in the provision of care for rare disease patients? How can e-health and telemedicine be integrated into healthcare systems following the experience of using these approaches during COVID-19 pandemic? How can we prevent the negative health and economic implications of COVID-19 and future emergencies for the care of rare disease patients? These are key questions that we must address and we must solve in order to be prepared for the next waves of COVID-19, but also for the next pandemics. Avanti, per favore. So in order to answer to these questions, we came up with a decalogue of organizational points to consider in order to be sure, to be prepared, and to be ready to provide appropriate care to rare disease patients in case of new health emergencies. So very quickly, the 10 organizational points to consider. Avanti. The first step is to try to learn from what happened in the last year. So we must absolutely have a very clear picture of the implication that from a clinical and from an organizational point of view, COVID-19 pandemic has produced. So we must analyze very carefully, very in detail what happened in order to collect precious information to help us in designing a system that might be resilient enough and able enough to manage future possible pandemics. Avanti. The second step is to implement and/or adopt emergency plans. We, for the very first time, experienced this pandemic in this century or in the last century. So we had to put in place reorganizations that we are not ready for. So now we must absolutely implement and adopt emergency plans in order to be ready, to be prepared for possible new pandemics in the new years, in the near future. And this would be very important to have it, of course, not only at the national level, but at a European level. Because as we have seen, and in the definition of pandemic, when an event like this happens, it impacts on not only on a specific region, a specific country, but for all the countries. So we should have, at an European level at least, an organizational model that might help the different countries to deal in a homogeneous way the pandemic in order to guarantee to rare disease patients the continuity in the provision of care, no matter where the patients live. Avanti, per favore. The third issue is to develop and adopt national and local protocols for the protection of people living with rare diseases during care delivery. So, as we all know, rare disease patients are even more fragile than the other patients. So, when they enter into the hospital, into the clinic, disease-specific protocols should be in place that take into account the specificity and the frailty of rare disease patients. So we should define protocols for social and physical distancing and other protective measures in and outpatient clinics and emergency rooms in case of infectious disease, new health emergency. So this is another very important step to protect patients, rare disease patients visiting our hospitals. Avanti, per favore. A fourth topic is related to the implementation of harmonized e-health and telemedicine platforms for rare disease patients. And this, as Emilia and Dominica have highlighted, this is a very important service that might be put in place by our systems in order to maintain a relationship with the patients, even when they might not be able to come to the hospital. So this is a very important service based on nowadays standard technologies. But we need harmonized e-health and telemedicine platforms in order to guarantee an equal access to these services everywhere in Europe. And it's not simply a matter of technology with respect to this service. It mainly is a matter of organization, because we must also train the healthcare professionals. We must change their routines. We must put in place a different organization and a different way of managing the relationship with the patient. So we must be prepared under this respect in case of new pandemic. Avanti, per favore. Another issue is related to the availability of treatments and essential services for rare diseases. As I mentioned before, in the COVID-19 pandemic, in particular for patients affected by rare diseases, in the rare connective tissue diseases, in some countries, in some areas, they experienced a lack of some drugs that were used in the treatment of COVID-19 patients. So in conditions where we have orphan drugs and the use of off-label treatments, we should consider the risk that we may have suffer from a shortage of those drugs. So we must put in place procedures that might facilitate the procurement of those drugs and of those treatments. And this may go through the definition of European and national policies that should be optimized in order to ensure the accessibility of these drugs always, and the definition of a list of procedures and protocols that might fasten the procurement procedure when we are experiencing pandemics. Avanti, per favore. Then another step, another issue from an organizational point of view is to ensure the prompt development of recommendations and communication material at different levels. And in this case, as also Dominica was anticipating, we should really rely on existing national, but also sometimes regional, national and European rare disease networks that may really accelerate the production of recommendation and communication material that might be very useful to the different stakeholders in the rare disease world. So we should rely on regional networks for the management of rare diseases, national networks like the one that is led by Dominica in the Istituto Superiore di Sanità, but also at the European level, like the European reference networks that cover many different rare diseases. So we should rely on these networks and try to adopt a co-design approach, trying to work together with the different stakeholders, the clinicians, these networks, and the patients' associations. Next, please. Avanti. We should collect, elaborate, and disseminate good practices related to the management of rare diseases in different countries, in the different regions, in the different hospitals. In the last year, we have experienced many beautiful projects and organizational innovations that help the clinicians and the patients to deal with rare diseases, and we should be able to collect all those best practices, good practices, and share these experiences among the different countries, among the different contexts in Europe, in order to learn among each other. Avanti, per favore. Then it is very important to disseminate reliable information on health emergency and rare disease at different levels using existing networks, because it's not simply the effort should not be simply focused on creating this material, but also to disseminate this material everywhere, and again the many networks that already are in place at the regional, national, European level are very precious in this respect. So let's involve in this activity the European reference networks, the national and regional networks for the management of rare diseases, and of course the associations of patients at the different levels, European, national level. Avanti, per favore. Then we have, considering that rare disease patients are even more fragile than standard, than the other patients, and also their disease impacts even more on the life of the family and of family, relatives and friends. We should also define essential social services, home care delivery, economical support to be ensured during the emergency, in order not to leave alone the patients, rare disease patients, but also their families during emergencies like the COVID-19 pandemic. So we must define a list of essential services that must be delivered always during a possible emergency. Avanti, per favore. And the last point is focused on another organizational issue, that is the definition of protocols to allow patients to travel. If they need the provision of healthcare services abroad, there might be in place organizational procedures, organizational protocols that might allow patients, rare disease patients, to travel and to move and to go abroad. And this is another issue that must be defined in advance. Avanti. So the last two slides for deriving some conclusions. I hope that in this seminar, we also with the other two speeches, we highlighted how the organization of the overall service and the network that must support the provision of care really matters. And it always matters, but especially during emergencies when the priorities are different, and the priority of healthcare policymakers are to try to manage the emergency. So we must have in place an organized system that might help the different stakeholders to manage rare disease patients, not to interrupt the treatment, and to guarantee high standard continuity of care. The next, please. Why the organization is important? The organization is important because when we talk about an organization, we talk about a codification of procedures, a codification of actions. And this is important at the European and at the national level, because if we codify, if we standardize what we have to do, we not only guarantee continuity of care, and we are much more prepared to manage criticalities like the ones that we have experienced the last year, but we are also increase the homogeneity in the management of patients affected by rare diseases. So we increase the equity of access to the treatment for rare diseases, and at the same time, as the organization is much more efficient, we also pursue a very important aim in our healthcare system, that is the economic sustainability. So let's invest more effort in designing our networks, in designing our organizations, and the experience at the European level with the European reference networks, but also at the national, regional level in our countries may really play a very important role. And if we invest in this area, I'm sure we will be much more prepared in facing possible future pandemics. Thank you.
Thank you very much, Professor Turchetti, for this great presentation. It's a pleasure for us because we really shared many excellent information. I know that this is for people who doesn't know, of course, but I know that you already published many of these recommendations. So I recommend to all colleagues, even outside this webinar, because the webinar will be registered, but to go also to the publications are on PubMed are very important ones, and I think that they can really be useful. And the reason why we invited two different levels today, Romania, we said, of course, they share the same problems. I mean, during the emergency, they had many problems. Italy had the same, many problems. But we are trying to find solutions to this emergency. So, and I thank a lot to Professor Turchetti because they already are working, they worked already on funding organizational points really to consider, but also recommendations to follow in order to improve healthcare systems at different levels, regional, national, European level. I think that we can continue this discussion with maybe some collaboration with our friends in Romania, and we will see, because of course Europe has this great privilege now as a European reference networks, that it's really the framework for improving, for increasing collaborations, and so we will continue this discussion. I think it's very, very important. So now it's almost, but we can have, if you want to have questions, we don't have questions from the participants. They will write the questions and we will forward to you later on. But if you have questions, Dorica, Annalisa, Emilia or Giuseppe, we can take 5 more minutes and then we close the session. Do you want to comment, for example, Annalisa or Dorica?
I would like to thank you for your invitation and for all the participants for presentation. And I would like to know if we can have the presentations, because it was very interesting to see all these recommendations. I think that's very useful. Thank you very much.
I think that Professor Turchetti can answer directly.
Yeah, no, with pleasure, definitely. And as Dominica was saying, many of these recommendations have been published the last week, really, in some journals. The last one is published in the Nature Reviews Rheumatology, but through Dominica, I will definitely send to you some references that might be useful, maybe. But we can absolutely share also the presentation.
Okay, this is great. Please, Marisa.
Yeah, remember that you have the recording of this webinar on the Facebook page of Uniamo, and also in YouTube. I think also both the pages of Uniamo and Istituto Superiore di Sanità. And I would like to thank Emilia because she presented in Italian, and it was great. Thank you a lot to try to speak in Italian. You speak a very good Italian, certainly much more better than my English. So thank you a lot, really. And I think it was a wonderful webinar, full of contents, and we have to learn one to each other. And I think we have to learn a lot from you. Okay, and thank you. Thank you.
And also this is an opportunity, as I said, to start also new collaboration. Maybe we can follow up, of course, this webinar and see if on specific points we can collaborate. This is the beauty of the webinar, international webinar, of course. And I hope that this will be done very soon. I would like to thank all speakers, and in particular, yes, Emilia. I'm sorry that I know that she speaks very well Italian because she's studied in Padua. So this is and she loves Italian. So, but unfortunately, as I said, this is the first edition of the international webinars, and many countries are from EU and outside EU are following us. So it's better to speak English. And I'm sure next time will be, very interesting. I can anticipate that we are invited Bulgaria. So we will again match two countries, Bulgaria and another one, and we will see what we can learn each other and how can strengthen the collaborations. So thank you to Professor Turchetti, thank you to Professor Severin, to Dorica Dan, my friend, Dr. Dorica Dan. Thank you to Annalisa, and see you in 2 weeks.
Thank you, Dominica.
Thank you.
Buonasera.
Bye.
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 Ciao a
Thank
tutti.
you.
Thank you.